Hi, I'm Dr. Shruti Kebinu. As a part of creating public awareness, Save the Tooth campaign is being conducted by DentistChannel.Online, and I'm very glad to be a part of it. In this video, I would like to talk on bleeding gums. Do you often see your gums bleed after brushing your teeth? Yes, it's a very common complaint among every one of us. Why is it so? Let's see the reasons of bleeding gum. There are many reasons of bleeding gums, but here today I am going to emphasize only on few of them that we often look upon. First in the list is the first stage of gum disease called gingivitis or inflammation of gums. Here the gums appear reddish, tender and swollen. Why is it so? Gingivitis usually occurs when the plaque along your gum line is not properly removed. When I say this, many of you will have a doubt. I do brush twice a day, but still I have bleeding gums. This is because the plaque does not go away with your regular brushing and flossing. The plaque, being sticky in nature, breeds most of the problematic bacteria which causes inflammation, gingivitis and also tooth sensitivity. So this requires dental cleaning, or which is called dental scaling. A dental checkup once in 6 months and cleaning at the initial stage of the disease will bring back your gums to a healthier state. But if left untreated, gingivitis may progress to the next stage called periodontitis. And as the disease gets complicated, the treatment also gets complicated. So don't forget to visit your dentist once in 6 months. The next reason for bleeding gums is the intake of few medications. Certain drugs causes bleeding gums. Blood thinning drugs fall into this category. Blood thinners are prescribed drugs for patients who have had heart attack or stroke or who are at the risk of it. So the peculiarity of these drugs is that they prevent the blood from clotting. Therefore, it increases the risk of bleeding also from gums. Drugs like heparin, warfarin, aspirin come under this list. So I request all of you who go to the dentist to tell all your medical history and the medications you take to the dentist. Usually people hesitate to tell it, thinking the dentists are concerned only with your oral health. No, definitely all your medical history and medications you take will help the dentist to find the reason behind your bleeding gums or any other oral disease for that matter. The third reason for bleeding gums is the new flossing routine. Dental floss is a thread-like thing which we use for cleaning the food debris in between the tooth. So when you floss for the first time, bleeding is normal. But when you keep it do it for a regular basis, it will stop, bleeding will stop. So do continue it. And I would like to mention that dental flossing is an essential part for gum health. The next reason for bleeding gums is the wrong selection of toothbrush. Selecting a toothbrush requires several factors to be kept in mind. Usually a hard toothbrush causes bleeding gums. Dentists usually recommend a medium or a soft toothbrush. And also the correct brushing technique is another factor to be kept in mind. The toothbrush should be held at an angle of 45 degrees to the tooth. And prolonged brushing time is of no good to you. Just 2 minutes for twice a day is the ideal formula for good hygiene. And also keep in mind that you have to change the toothbrush once in every 3 to 4 months. Moving on to the last reason for now is the common monster among all of us, the stress factor. Constant state of mind agitation and anxiety will compromise the immune system. Stress also is found to cause inflammation of the blood vessels, which in turn will break down the soft tissues which leads to gingivitis and inflammation of the gums. Also, lesions like aphthous ulcer is associated with stress. So, move on to keep your mind in a calm state, reduce stress, more smiling, less worrying. By taking care of your oral hygiene with proper techniques, you can avoid most of the dental problems. As some great person has told, Be true to your teeth or else they will be false to you. I hope my video was helpful for you. I would like to conclude with the words of the campaign: Save the tooth, healthy smile, wealthy lives. Thank you.